Great. So thank you for the opportunity to be on the program today. My aim is to familiarize you with a key resource that Marguerite mentioned a few times but didn't really go into, with the hope that this will empower you to press on the guidelines development entities in this country to do a much better job of consumer involvement in the clinical practice guidelines. And so I think by now you have a pretty good idea of what the Guidelines International Network is involved with. And I think the important points that weren't mentioned are they have a robust guideline library, and they do a lot of their work through their annual meeting, regional communities such as G-I-N North America, and working groups. And this has already been covered, except to say that I want to focus, as Marguerite did, on the fact that many developers and other stakeholders are not yet engaged. So I think that's a real challenge for us here. There's some great examples of people who are really on board with this, but I'd say they're in the minority right now. So one of the working groups is the G-I-N Patient and Public Involvement Working Group, or G-I-N Public. And I've been a member of their steering committee for most of the 9 years that they've been going. And that group brings together consumers and consumer representatives, along with researchers who are involved with issues relating to patient involvement in guidelines, and also guideline developers that are actively involving consumers. And most of those are from other countries. So G-I-N Public ensures that there is a consumer involvement presence at the annual G-I-N meeting and other meetings. We work together to carry out research and prepare articles. We collaborate with people who are involved with consumer involvement across the continuum of clinical effectiveness activities, and we prepare the toolkit that Marguerite has been mentioning, and that's what I'd like to focus on today. And the toolkit was originated through a series of consultations that G-I-N Public did at annual meetings of G-I-N. And we have written these up in papers that are now published, but the gist of it is, no surprise, that guideline developers need help and need specific kinds of help, and we have tried to respond to that. So we have a living document which is available online, freely available, and at any given time the chapters are being updated, new chapters are being prepared, and this is intended to be adaptable for diverse contexts. So that developers can sort of localize it to their specific community and needs. We provide very practical guidance. We have discussions of various methods for patient and public involvement, and we have benefited enormously from the mature guideline development programs in other nations that have really given us some very good and fruitful information about the whole process of involving consumers. And I would call out in particular Australia, Germany, the Netherlands, Scotland, Spain, and the UK. So there's a lot of nuggets in our toolkit based on what we can learn from those programs. There's a gap. That was surprising when I realized it, is that we have nothing in the toolkit to support consumers who will be becoming involved in this process. So I hope that that can be rectified in the not too distant future, and perhaps some of you would take an interest in helping us to do that. The toolkit presents 3 different strategies which can be summarized with arrows. For consumer involvement, one would be consultation, where most of the information and knowledge are coming from the consumer community to the guideline development group and the guideline development enterprise. Another, participation, which I think is what most people in Q have been involved with to this point. That's a two-way street of collaboration. And the third is for more after the guideline is developed and pushing it out in various ways, which we call communication. Consultation is covered quite well in the toolkit. We really feel that it can be done and should be done at all phases of the guideline development cycle, but it's very valuable for a broad background at the beginning, for finding out for the relevant condition, what are their experiences, values, preferences, questions, and concerns, and for helping to ensure that the ultimate guideline is relevant and acceptable to that population. In addition to the obvious focus groups, interviews, surveys, and literature review that can be used for this purpose, there's a lot of fruitful work in many sectors these days in posting online the topics, the questions, draft documents, etc., and soliciting comments on those, and also making special invitations to expert patient and public reviewers to provide feedback. We try to uphold very high standards, and that includes prioritizing transparency, inclusivity, accessibility, input through all the stages, and disclosure of possible conflicts of interest. For participation, I don't think I need to go into the details, and I need to hurry up a little bit, but one question that always comes up is how many consumers, and the answer is don't even think about less than 2, and more would be ideal, and that they should bring complementary perspectives. The main qualification that we have identified is either a lived experience with the relevant condition, or in some cases being a carer for people with the relevant condition, or being familiar with a lot of people with that condition, and that's often from support and advocacy groups. And as with other members of the guideline development group, it's very useful and important to have good communication and teamwork skills, not to be shy, and be able to make the time commitment to do the job. We do recognize that after those qualifications, people can and should be supported, for example, with the Q online course, or other programs like NICE in the UK have formal training programs for consumers, and we identify other kinds of practical support as well that are required for this purpose. The toolkit gives guidance for developers for 2 different types of recruitment, either soliciting applications or finding out who would be a good person and reaching out and inviting them. And there's a whole chapter on the role of the chair, and of course the chair is crucial for how it goes overall, and really an important consideration for how it works for consumers. And so chairs should absolutely have an understanding of the value added that consumers bring to this and be modeling in a respectful tone. We also underscore that if other members of the guideline group are going to be accorded authorship and other kinds of thank yous, that this should apply to the consumer participants as well. Finally, communication. There are 3 chapters in the current toolkit. One looking at this whole possibility more broadly, a second one developing patient versions of guidelines, and a third one developing decision aids from guidelines. And the general chapter is basically developed from the Scottish Guidelines Agency, which has really elaborated all of the possibilities for engaging consumers in getting out your guidelines. So one is about, one strategy is, or objective is raising awareness generally. Another one is this whole, that we discussed before, implementation, dissemination, and then implementation. So then one type of dissemination is developing what are called patient versions of guidelines, and there's a chapter for that purpose as well. And it's usually the consumer model is the arrow going out, the communication model is the arrow going out. In this chapter is clear that we need to have a 2-way street around the development of this material. And this is an example. Really, it's using a guideline to do a good job of a patient education brochure or website or something like that. And the final type of product can be a decision aid in the circumstances where the situation is amenable to that, what we call preference-sensitive situations, where there would be more than one reasonable choice, and the choices may hinge on what the person's own values and preferences are. So there's a whole chapter for that purpose. So I hope what I have been able to, in this kind of whirlwind tour of the toolkit, share is that where there's so much unrealized potential in the U.S. in the guideline development enterprise, and that we can use this as a resource among many to do a much better job of strengthening the kinds of things that we're doing with consumer involvement in this country. And like Marguerite, I want to end with a proposal. I love the idea of lobbying the Guideline Clearinghouse, and also feel that we need to reach out, possibly Q and GIN North America together, to all the groups that show no signs or interest in consumer involvement at this point in time. They should know about the Institute of Medicine, now National Academy of Medicine standards. They should know that the toolkit is available, and they should know that Q stands ready to help them identify suitable, very appropriate consumers that can add value to their work. So thank you very much.